You have a variety of insurance options at Hennepin County. We offer health, dental, vision, short and long-term disability, and life insurance. Everyone here is benefit eligible, meaning your standard hours are 20 or more per week. If you don't enroll in health, dental, or vision as a new hire, you can enroll during open enrollment. This is generally held in November with a January 1st effective date. Qualifying life events such as marriage or birth allow you to change coverage at any time. Short-term disability, long-term disability, and life insurance may generally be changed at any time of the year. The benefits contact here today will tell you about your effective date and paycheck deductions. We deduct premiums pre-tax from your paycheck. We encourage you to select your benefits within 2 weeks, but you technically have 30 days to enroll. A dependent is anyone who can be covered through your benefits. Dependents who are eligible are your legal spouse, your child up to age 26, a grandchild under age 26 who lives with you full-time and you claim as a dependent on your tax returns, and a disabled child of any age. Double coverage is not allowed at Hennepin County. This means if you and your spouse are employees here, you must each carry your own insurance. A child may only be covered by one of the parents. Please take out your yellow sheet at the back of your benefits packet. You must submit this sheet along with the documentation noted if you want to cover your dependents for health, dental, or vision. Please submit copies of your personal documents. Original copies will not be returned to you. You can email the form and documentation to the HR Service Center. Social Security numbers are not required but encouraged for dependents. You will key this information into Apex when you select your benefits. Preferred One is our health plan administrator, and you have 2 plan designs to choose from. These are the Advantage Plan or the Standard Plan. First, let's discuss the Advantage Plan. With this, you choose one of 3 options when enrolling in your benefits. The first option is Fairview North Memorial Health East. The second is Health Partners Park Nicollet. The third is Hennepin County Medical Center and North Point Health. Some benefits of the Advantage Plan are lower premiums, lower copays, and more coordinated care. It also has a concierge phone line to help you with health questions. If you're looking for the least expensive premiums, the HCMC network has the lowest premium with no deductible and the lowest copays. They have clinics throughout the county. When you choose an Advantage network, you are agreeing to receive all your care through that network of providers, so make sure your current providers are a part of that network. The second plan is the Standard Plan. This allows you to have access to any provider or network within Preferred One. Each provider is assigned a tier. The higher the tier, the higher the deductible and copays. The Standard Plan has higher premiums, but allows access to more providers. We'll do a demonstration later to show you how the provider search works so you can see if a clinic or doctor is in a specific network. Now, we'll show a video showing the Be Well Clinic.
The Be Well Clinic and Pharmacy is located across the street from the Hennepin County Government Center on the corner of 4th Avenue and 7th Street. It's your workplace clinic, giving you access to high-quality healthcare services with scheduling that works for you.
Nice thing about being here and being convenient. If you ask somebody to follow up, sometimes that's a lot to ask of somebody if they have to take time off of work. And This works out well for that because I can have them come down and it may half an hour to an hour of their time rather than a half a day.
You and your adult dependents get the care you need when you need it in a convenient, state-of-the-art environment, staffed by specialty trained physician assistants, nurse practitioners, and licensed chiropractors and acupuncturists. Services include comprehensive primary care and wellness care, diagnosis and treatment for most common conditions, and immunizations. And there is no deductible or copay for you or your dependents covered by any of the Hennepin County health insurance plans through Preferred One.
The convenience factor is what got me in the door, but the quality of care and the professionalism of the staff kept me coming back.
The Be Well Clinic also has a full-service pharmacy to provide a convenient option for your prescription and over-the-counter medication needs. Normal insurance copays apply.
Here at the Be Well Pharmacy, we have very short wait times, 2 to 3 minutes on average. We take prescriptions from all outside providers.
The clinic is open from 7 a.m. to 5 p.m., Monday through Friday. The pharmacy is open from 8:30 a.m. to 5 p.m. Call 612-873-7373 to make an appointment. When you need quality care that's convenient and quick, the Be Well Clinic is there for you.
Just to recap the video, the Be Well Clinic is located in the 701 building in downtown Minneapolis. In addition to physician assistance, the clinic offers chiropractic care, acupuncture, and OB/GYN care. There is no copay for care received at this clinic if you are enrolled in the county's medical plan. Your adult-dependent children, if enrolled in our plan, are also eligible to use the clinic with no copay. There is also a full pharmacy on site. Regular copays apply to prescription drugs. If you do not have the county's medical plan, you can use the clinic, but your plan copays will apply. Online care allows you to complete a 5 to 10 minute online assessment for common illnesses or conditions, many of which can be often diagnosed and treated without an office visit. Online care saves time and money. There is no copay for online care. The plan and network you're in determines your online care provider. All plans have access to MD Live, and then each Advantage plan has an additional online care option. For example, the Fairview North Memorial Health East Network also has OnCare. You can be covered for just yourself, with your spouse, with your children, or as an entire family. You can also waive health coverage. When you enroll, you will automatically be placed into one of these categories based on the information you input. Any questions on health insurance? The voluntary dental insurance is provided by Health Partners. This is a comprehensive dental plan. For children up to age 13, all care is covered at 100% and there is no annual maximum. The only exceptions are braces and implants. Orthodontia is covered for children up to age 19. If you use a preferred provider, you will receive a 15% discount, saving you nearly $900 on the treatment. You have the option of single, family, or waiving the coverage. Some unions also have dental plans provided through Delta Dental. This is separate from this dental plan. We do know that Delta does not offer orthodontia, but Health Partners does. You can be enrolled in both plans. Note that preventive coverage for children under the age of 19 is part of the health insurance plan. This covers twice-a-year cleanings and x-rays. It does not cover fluoride treatments or more extensive work such as fillings. You must use the Preventive Dental Network through Preferred One to receive this benefit. Any questions on dental insurance? The vision insurance is provided by iMed and is a materials-only plan. This means that your eye exams are through your health plan. The vision plan allows you to receive a $175 allowance for frames plus a $175 allowance towards contacts or use of the lens benefit. Once the benefit has been used, you have additional discounts on complete pairs of frames and lenses. Please see the EyeMed website for more details. Prescription safety glasses are not covered. The benefits reset each January 1st. For example, let's say your benefit effective date was November 1st and you used your full frame and lenses allowance in November. In January, you had a vision change that requires you to get new glasses. You can use the frame and lens allowance again since the benefits reset in January. Any questions on the vision insurance? Disability insurance is income protection in the event you can't work due to an illness or injury. Think of it like car insurance. It's there to protect you when you need it. The disability insurance carrier is Standard Insurance Company. You are eligible for disability insurance if your standard hours in Apex are 30 or more hours per week. The premiums are deducted from sick leave or PTO, rather than a cash deduction from your paycheck. Having short-term disability is your choice. You can also choose how long you wait for disability coverage to begin. Options are 7 days, 14 days, 30 days, or 45 days. If you don't sign up as a new hire, you'll have a 60-day late enrollment penalty when you choose to get this. This means no matter which option you sign up for, 7, 14, 30, or 45 day, you have a 60-day waiting period the first 12 months for illness. Also, if you change to a shorter waiting period, you are under the late enrollment penalty for the first 12 months. The maximum benefit period is 90 days minus your waiting period. So if you choose a 7-day waiting period, you will receive benefits for up to 83 days. If you were to file a claim and it's approved, your weekly benefit would be 60% of your pre-disability earnings. You are automatically enrolled in long-term disability. The waiting period is 90 days. If you have both short and long-term disability, your short-term disability claim will automatically roll to long-term disability if you continue to be disabled. This benefit is paid monthly and is 60% of your pre-disability earnings. Any questions on disability insurance? The county provides up to 120 hours of paid parental leave following birth or adoption for all parents. This is prorated for part-time employees. You must have an approved leave and the hours must be used within 12 weeks of being approved. New hires are eligible to receive paid parental leave even if they are not FMLA eligible. The Leave and Accommodation Management Office coordinates paid parental leave, FMLA, and income replacement options. Any questions on paid parental leave? The county provides you with a $30,000 basic life insurance policy. You may also have additional life insurance for yourself. If you do this, you may also add spousal or domestic partner life or dependent child life for additional costs. Premiums for the additional and spousal life are based on the employee's age. All new hires have a default date of birth in Apex until your I-9 information is complete. As a result, the life insurance premiums on your new hire enrollment will not be correct. They are based on a fake birth date. The premiums will autocorrect prior to your first deduction. Additional life insurance is available for you, your spouse or domestic partner, and any eligible dependent children. As a new hire, your guaranteed issue amount is $100,000 without evidence of insurability. Anything over that amount does require evidence of insurability. The employee must have additional life insurance in order to get spousal life. The guaranteed issue amount for spousal life is $50,000 and based on the employee's age. Dependent child life is for dependent children up to age 19 or 25 if a full-time student. The cost is the same no matter how many dependent children you have. See your benefits handout for additional life insurance details. Make your beneficiary designation when you enroll in your benefits in Apex. You are automatically the beneficiary for spousal life or dependent life. We have a life premium calculator on our website for you to understand costs. You'll see a demonstration of this at the end of the presentation. We have many additional features available under the life insurance plan, including emergency travel assistance. How many of you or your dependents travel over 100 miles from home? This service includes pre-trip assistance, medical assistance, emergency transportation, to name a few. Life Services Toolkit. This offers tools and information that can help with creating a will and making advanced funeral plans. Accelerated Death Benefit. This is for members under age 60 who have a terminal illness. They may receive a one-time lump sum payment up to 75% of their life insurance benefit. Any questions on life insurance? Next, you're going to hear about flexible spending accounts, the required pension plan called PARA, the healthcare savings plan, and optional commuting programs. The flexible spending accounts are pre-tax deductions that reduce your taxable income. The county has 3 plans to help you pay for specific expenses with pre-tax dollars. The healthcare expense account is for health, dental, and vision expenses you pay out of pocket. The maximum you can select for this account is $2,650 per employee per year. The account also has a $500 rollover feature. Claims are due by March 31st for the previous year's expenses. The healthcare expense account can be used for any dependent you claim on your taxes, even if they are not on any of the county's insurance plans. The total amount you select is available to use as soon as you are enrolled. If you enroll, you will receive 2 Visa debit cards. Use these in place of your personal credit or debit cards for making a payment or making a copay. Second, the Dependent Child Care Assistance Program is for daycare expenses. The family annual maximum is $5,000. Different from the healthcare expense account, this program requires that you have money in your account before you can get reimbursed. Finally, the Adoption Assistance Program is for expenses incurred in adopting a child, such as lawyer fees and home visits. The annual maximum for this program is $12,000. These are use it or lose it programs. Note that the healthcare expense account will roll over up to $500 to the next calendar year, so please be conservative in your selections. Enroll now with all of your other benefits and then re-enroll in these during each open enrollment in November of each year. If you do not enroll now, you can enroll during open enrollment. You have 30 days to select your flexible spending account, but the sooner you sign up, the sooner the benefit begins. Your effective date is the date you sign up in Apex. Expenses prior to this date are not eligible for reimbursement. All flexible spending account amounts are deducted from each paycheck. Any questions on flexible spending accounts? Now, we're going to shift from annual flexible spending to long-term retirement planning. Hennepin County participates in a required pre-tax retirement plan known as a pension. Most employees will contribute to the coordinated plan. Correctional officers contribute to the correctional plan, and sheriff's deputies contribute to the police and fire plan. The percentages you see here are set amounts and cannot be changed. This benefit is deducted from each paycheck. You will become vested after 5 years of working as a public employee, which means you will receive a lifetime monthly amount after you retire. The amount you receive is based on your age, years of service, an average of 5 highest consecutive earning years. If you leave public employment before 5 years, you can request a refund of your money including interest. The employer portion is not refundable. If you've been a public employee in Minnesota previously, contact PARA to combine your accounts. Any questions on PARA? Next, we're going to talk about the healthcare savings plans, which is different from the healthcare expense account we have already discussed. This healthcare savings plan pays for medical, dental, and vision expenses and premiums after you end your employment at Hennepin County. This is a required pre-tax plan for union employees and for non-union employees in certain job classes. This benefit is deducted from each paycheck pre-tax. It is also never taxed when you use it. Your key information sheet will indicate if you participate in this benefit. Union employees are auto-enrolled with a 1% deduction. Non-union employees have various contribution amounts based on job class that could include percentage of earnings, severance, and/or retention pay. If you are not in a union and your key information sheet indicates that you participate, contact the HR Service Center to find out specifics of what your deduction will be. The account and investments are administered by Minnesota State Retirement System. You will receive a welcome packet from them in the mail, so you can choose your investment options and select a beneficiary. You may be able to waive participation in this benefit. Contact Minnesota State Retirement System for approval. Any questions on the healthcare savings plan? Now, let's talk about additional retirement contributions you can choose to make. Deferred compensation allows you to set aside additional pre-tax or post-tax money for retirement savings. This is a 457B public employer retirement plan, which is similar to a 401k used in the private sector. You can enroll in this benefit anytime. Note that the after-tax Roth contribution option is different from any personal Roth IRA you may already have. The vendors available are Voya, Minnesota Deferred Compensation Plan, and Fidelity. Contact the vendors to research, discuss options, and choose the best option for you. Make sure you look at our website for specifics. Any deferred compensation questions? Now, let's talk about your benefits related to your commute. The county offers pre-tax Metro Transit cards that can be used for taking bus or light rail. You have 2 options to choose from. The Metro Pass provides unlimited rides each month for rides that cost up to $3.25. The county contributes 40% towards the cost. Employees pay about $45 pre-tax each month for a Metro Pass. The Go-To card is a pay-as-you-go card. A specific pre-tax dollar amount is loaded to your card. You can start, stop, or change your Go-To card amount at any time. The county pays 40% of whatever your Go-To card selection is in Apex. Choose to have the Metro Pass or a Go-To card. You may not have both. This commuter benefit is for employee use only. If someone else is caught using your pass, the fine is $180 and you will not be able to receive another card. Depending on which option you choose, the enrollment process is a bit different. For the Metro Pass, register in Apex first by 10 a.m. on the 13th day of any month. Then you can begin using your Metro Pass on the first day of the following month. Human Resources will contact you to pick up your card. For the Go-To card, purchase a card from Metro Transit or from one of the multiple providers. Visit Metro Transit's website to find your options. Then, go into Apex to select your amount. Enter your 16-digit Go-To card number to connect the amount you select to your specific card. We also have a pre-tax parking program and a van pool program. First, if you park in one of several county-owned parking ramps and have a monthly contract for that ramp, your parking fee is deducted directly from your paycheck pre-tax. Work with Facility Services to park at one of these locations. Note that some county-owned lots have waiting lists. Second, if you park in a non-county-owned location, you can enroll to get reimbursed for parking on a pre-tax basis. This is possible for both monthly contracts and daily parking anywhere. This is also applicable for bicycling parking. You must fill out reimbursement forms every 180 days to get reimbursed out of this account. The maximum contribution per month for both of these options is $260. You can change, start, or stop at any time. Finally, you may also participate in a pre-tax van pool program. Contact the HR Service Center if this program is of interest to you. Any commuting questions? The county also offers additional benefits we'd like you to be aware of. Maersk. This is an employee discount program available to you. Before you buy anything like event tickets, park passes, or professional services, please check out this website for discount options. The Minnesota Benefits Association offers a variety of voluntary benefits including scholarships, auto lease and purchase programs, auto insurance, long-term care insurance, and pet insurance. Employees need to contact MBA directly to enroll. MBA will contact the county to set up your deduction in Apex. Next, the Minnesota College Savings Plan allows you to set up an account to save for your children's higher education. Payroll deductions grow tax-free. Employees need to call the Minnesota College Savings Plan to enroll. Separate from the county-sponsored life insurance options presented earlier, PARA also offers life insurance. The premium is $16 a month, and the benefit varies depending on your age. This is not part of your new hire enrollment. Review the PARA Life Insurance webpage for additional information on how to enroll in this decreasing life insurance plan. As a new hire, you have 30 days to enroll, or you can enroll every October or November. This is separate from the county's open enrollment. Finally, you should know about the Public Service Loan Forgiveness Program. County employees who took federal student loans may be eligible to receive relief from remaining debt if you meet the following criteria. 10 years of on-time monthly payments, payments that were part of a qualified repayment plan, and you work full-time at a non-profit or government employers during the 10 years. Any questions on other benefits?